to today's webinar short. We'll be talking about the multiple procedure payment reduction. My name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance education and consulting firm specifically for physical, occupational, and speech therapy practices. We offer full-length continuing education courses, guides, and sample forms for Medicare, TRICARE, HIPAA, NCCI, OSHA, and other important compliance. All 50 states, PT, OT, SLP compliance guides and policies, Medicaid, workers' comp, pediatric services, home health, medical records, liens, waste, fraud, and abuse. We also offer ongoing and comprehensive support for our members. Disclaimer: this presentation is for informational purposes only. None of the material is intended as legal advice. Statutes, regulations, and guidance material are subject to change. So the MPPR was effective on January 1st, 2011. Medicare applied an MPPR to the practice expense or PE payment of select therapy services paid under the physician fee schedule or paid at the physician fee schedule rate. Effective for claims with dates of service April 1st, 2013 and after. Section 633 of the American Taxpayer Relief Act of 2012 revives the reduction to 50% of practice expense PE reduction for all settings. RVUs, or relative value units, for Medicare reimbursements are calculated based on the CPT code used and the relative value units, RVUs, of each code. Practice expense, relative work, and malpractice expense are all components of the total RVU code. So RVUs contain a physician work or therapist work, 52%, practice expense is 44%, and malpractice expense is about 4% of the total RVU. The MPPR policy implements a 50% payment reduction to the practice expense value. The other values, physician work or therapist work, malpractice expense, stay the same. And in total, it works out to around a 7% total payment reduction for therapy services. So codes. The MPPR applies to services labeled as always therapy. This is most of the codes that's used by physical, occupational, and speech therapists. In general, an always therapy is any service that you can bill only when you include it in the patient's plan of care. All therapy services performed by a group on the patient in that day have the MPPR applied. So if you have PT and SLP services or PT, OT services are done on the same day, but by the same group under the same MPI number, the MPPR is going to be applied. You can see the codes that are always therapy. If you go on the Medicare annual therapy update, that contains a list of codes that are considered to be always therapy. And also on Therapy Comply's Medicare page, we have a link to that and also a link to the RVU page. Units and procedures. So for time codes, the first unit of the highest RVU code is paid at 100%. Subsequent units of the same code or other codes, both timed and untimed, with the lower RVUs have the MPPR applied. So even if you're doing the same service the whole way through, the first unit is billed at 100%. Any subsequent units going to be billed with the MPPR applied. Untimed procedures work the same way. So those with the highest RVU are going to be paid at 100% for that one unit, and any other time codes or untimed codes that are performed after or at any time is going to have the MPPR applied. So the order of when services are performed does not matter. It is only on what is the highest RVU, and that unit is the one that's paid at 100%. Any subsequent units are going to be have the MPPR applied. Okay, so a little bit how this works in a chart. So say you have procedure 1, unit 1, that's going to be paid at the highest amount if it's the highest RV, because it's the highest RVU. So work is $12, PE $10, malpractice 1 will be a total of $23, MPPR calculation would stay the same. Procedure 1, unit 2, so same procedure, but because it's a subsequent unit, the MPPR is going to be applied. So $12, same for work, but with the 10, with PE, instead of doing $10, you multiply that by 50%, so that's going to be $5. Malpractice stays the same at 1, so it's going to be in total $18. Procedure 2, and any subsequent units after that is also going to have the MPPR applied, so $10 front. Normally the PE would be $8, but in this case again, MPPR, you reduce it by 50%, so now it's $4. Malpractice stays the same. Normally the unit would be billed at $19, but with the MPPR applied, it's $15. The total payment normally would be $65, but with the MPPR, it's going to be $56. So that is really how that works in practice. This is an automatic process. Nothing you can do will change this process. It just works how it works. And just a little some examples of how the RVUs work and the PE. So this is just a piece out of the Medicare guide on RVUs. So just see that typically your evaluation is going to be the highest RVU. So if you bill an evaluation on and subsequent treatment, that evaluation is going to be billed at the highest amount, and any subsequent units, time code or on-time code, is going to be billed with the MPPR because that's a higher code. Also another example, so if you have, for say, neuromuscular reeducation at 5.50, that's rather high. But if you bill subsequently after that, like therapeutic activities, which is 0.65, which is higher, that therapeutic activities is going to be billed at 100%, where the neuromuscular reed or therapeutic exercise, anything like that, is going to be billed with the MPPR. So that just gives you an idea of the RVUs. Higher the RVU, the highest RVU is the one that's paid at 100%. Any subsequent codes or anything done before or after that has a lower RVU or is the same code that's just done after has the MPPR applied. And that is basically how that works. Well, thank you so much for joining me today. Please visit us at therapycomply.com for more guides on therapy services, and like and subscribe to our Therapy Comply page to find out when we add new videos. Thank you very much.